Hello, Indian Hills. We are here today to talk to you about the COVID vaccine, as well as common questions and misconceptions you may have about it. My name is Summer Bird. I have a master's in human anatomical sciences, and I'm a biology instructor here teaching mostly anatomy and physiology courses.
Hi, I'm Lori Kellner. I've been a nursing instructor for 15 years here at Indian Hills. I teach a variety of the nursing classes from med-surg to OB to peds. I'm also a seasoned nurse, and I've been practicing since 1986 in multiple states, in multiple fields. My current place that I'm specializing is in high-risk pregnancy in this obstetrical emergency department and the high-risk area inpatient, and I am currently working with COVID patients.
You have some really fantastic firsthand experience for us. So, Lori, can the COVID vaccine affect my fertility?
Well, first, before I respond to that, where I get my information, I've gotten it from the perinatologist, Jason Bocconi at Mercy One. I've looked at the CDC, and I've looked at some of my information that I've gathered when we talked today from the National Institute of Health. What has been written and what has been said, Dr. Surthy, the U.S. Surgeon General, has also said that it will not affect fertility. And the CDC on their current website also, with all the data and evidence that they have looked at, no vaccine has ever caused any problems with fertility, including COVID. So I got a question for you.
Yes, ma'am.
Okay. Is the COVID vaccine effective?
Effective. So to talk about whether or not the COVID vaccine is effective, I first want to talk about the difference between prevention of infection versus prevention of hospitalization, because there's been, I think, some confusion between those two in the media lately. Prevention of infection prevents you from getting infected with the virus at all. And right now, all of the vaccines that we have approved for use in the US are very good at preventing infection, especially right after vaccination, and especially after both vaccination doses. Prevention against hospitalization, or prevention of hospitalization, is also something we look at. So sometimes when you get infected after you've been vaccinated, prevention of infection will prevent you from getting so sick that you need to be hospitalized. Prevention of infection after vaccination is in the high 90s. What tends to wean and decrease after time, if it's been a while since you've had the vaccine, is that prevention of infection. So if it's been a while since you've been vaccinated, you may be more likely to get infected. But what's not going down is prevention of hospitalization. Even if it's been 6 months, a year since your vaccination, it seems to be so far with the data that we have that your prevention against hospitalization is still in the high 90s, even if your prevention of infection is waning a little bit, 80, 70, 60 perhaps in some cases. So right now, yes, the COVID vaccines that we have are very effective against both. And then after time, prevention of infection tends to decrease. So that's why we might be looking into booster shots for certain populations. So Lori, am I better off to acquire COVID and obtain natural immunity rather than getting the vaccine?
What happens is when you have natural immunity, it will protect a particular strain, where what they're finding with the vaccination is that it covers a broader range of COVID variants. So for that reason, the feeling is that the vaccination is better because you'll be able to cover more variants of the COVID with the vaccination versus natural immunity.
Right, because we have alpha, beta, delta. So if you've been infected, you might be partially protected against one of those, but you're saying that infection doesn't seem to help prevent against other strains?
Yes, so to quote the CDC, new evidence shows that protective antibodies in response to the mRNA vaccine target a broader range of SARS-CoVs compared to the antibodies required from infection.
That's great, especially since it keeps kind of mutating into new strains.
Yeah. Can the COVID vaccine alter my DNA? That's the question for you.
Short answer, simple answer, no. The COVID vaccine cannot alter your DNA. So the COVID vaccines that we have now are mRNA vaccines. That stands for messenger RNA. RNA is a molecule that is basically an instruction manual that tells our cells how to build proteins. RNA is not really chemically active. It doesn't do anything. So when we inject this RNA into your muscle cells. Your muscle cells take up the RNA, and then a ribosome is going to read those instructions and build a part of the spike protein that's on the outside of the virus. Not the virus itself. No part of this spike protein is like infectious, but it is the part that your immune system reacts to. Your immune system reacts to this protein on the outside of the virus. So when our cells build this protein, it says, hey, this isn't a part of us, and you have an immune reaction, which is what causes the side effects of the vaccine. So swelling at the site, fever, muscle aches, potentially, depending on your personal side effects. And it's not active. It doesn't do anything. When your ribosomes are done reading it, your cell destroys it. Your DNA is encased inside of an organelle in your cell that's known as a nucleus, and the mRNA can't even get in the nucleus. So even if it was chemically active, even if RNA did something, it can't get into your nucleus to be anywhere near your DNA.
So you know how you're talking about the mRNA, and I remember reading an article from the National Institute of Health, and it was talking about, you know, rather than normal viruses, how you replicate the virus and you put it in a pathogen. Mm-hmm. This particular one, when they are able to replicate the virus and use that in the protein, that it's in a better state for people that have comorbid conditions, because it doesn't affect them as strongly, so that it has a good efficacy for people that are vulnerable. But also because of that, there are chances, just like with a flu vaccination, that you'll require boosters.
Absolutely. Yeah, so there is no part of the virus like itself. There's nothing infectious in the RNA vaccine. Mm-hmm. So you're right, it is safer for people with comorbidities. So Lori, can I get sick or die from receiving the COVID vaccination?
Well, we get common side effects that we get from all vaccinations. Mm-hmm. Muscle soreness, tiredness, fatigue, achiness,
right.
Nausea, malaise, things like that. Those are normal things that we'll get. There are two serious side effects that are listed in the CDC website. Mm-hmm. To quote the incidence, it's 2 cases per 362 million people of anaphylaxis. I'm quoting myself wrong. There's 2 to 5 per million of anaphylaxis. But the thing about anaphylaxis is anybody can have anaphylaxis to any type of medication. So we as medical people know how to treat that.
Absolutely.
So that, to me, is not too much of a deterrent, because we know how to fix that.
And that is such a low chance to start with compared to how infectious COVID is and how many problems COVID can cause for you.
Right, 2 in a million. So that's very low, and we know how to treat it. Mm-hmm. So the other thing, you know, a lot of people have talked about, we've heard about myocarditis and pericarditis, and that has been on the internet of a concern with the COVID vaccinations.
Right. So inflammation of the heart muscle and the tissues that surround the heart.
Yes, ma'am. And but usually that happens with a second dose, and it's usually with men under the age of 30. So there was 1,413 cases reported, and 854 were confirmed. But in going in further about vaccinations, there were 7,653 deaths with people that were vaccinated out of 380 million people vaccinated. But the problem with that is that doesn't take into account comorbid conditions. So it wasn't potentially the vaccination that killed them, that just they were more vulnerable to the infection because of the comorbid conditions. And how it is listed in the CDC, this is the reports of the adverse events following vaccines, including deaths, do not necessarily mean that the vaccine caused the health problem.
Especially since early on, we started off by vaccinating people who were already really prone to other health conditions, right? So that really kind of played into those numbers. Right. We vaccinated the older populations and the more likely to be harmed heavily by COVID populations. So they were more likely to get those other conditions also. Right.
The immunosuppressed, the diabetics, and things like that. Yep, that's right. Oh, this goes right into yours, though.
Yep.
Can I get the COVID vaccine if I have an underlying condition or previous vaccine allergy?
In almost every case, yes, you will still be recommended to get the COVID vaccine, even if you have some sort of underlying condition or if you have a previous allergy to some other vaccine. Once you get into that territory, I highly recommend you talk to your doctor, set up a health plan for you in particular, weigh the risks and benefits with your doctor. What it comes down to is, like we mentioned earlier, getting COVID is a lot more likely to impact your health negatively than a lot of the side effects from the vaccine, even if you have a comorbidity or an allergy. If it comes down to it, they will most likely just, if you are in danger of having an effect from the vaccine that might harm you, they will most likely recommend that you get the vaccine in the presence of a medical professional. So get the vaccine in a hospital just in case you have a reaction to it, rather than like at the pharmacy down the street.
Yeah, and every time you get vaccinated, because of that anaphylactic reaction, we usually keep them 30 minutes just in case to watch for such reactions. So
Absolutely, just to make sure, especially
Yeah.
since there were some reports of it early on.
Yeah. Okay.
So Lori, are there any long-term comorbidities secondary to receiving the vaccination?
The CDC says no. No long-term effects so far have they found. How can I trust the vaccine because it was created so quickly?
So, long story short, it wasn't. mRNA technology, like these vaccines that we're making using mRNA, have been around since at least 2003, and they were at least playing with it before then. So if anybody remembers SARS, severe acute respiratory syndrome, and MERS, Middle East respiratory syndrome, that was in like 2003. Those were coronaviruses very similar to the COVID-19 virus. And we made full vaccines using mRNA technology for those diseases. They went through clinical trials. They were administered, especially to frontline health professionals. So we have data of this vaccine from almost 20 years ago being used safely, being effective, and we still have data from those patients who were vaccinated then to show that there are no long-term effects. So really all we had to do was sequence the virus and figure out what part of the virus we needed to make that protein and just put that part of the mRNA in a vaccine we had already made. So we really just needed to edit something that we have been playing around with for decades.
Very good. I remember that, what it's called, Guillain-Barré's.
Oh,
so,
yeah.
So a lot of vaccinations, and I mean, it's not statistically significant, but Guillain-Barré type of paralysis, which is very, very rare.
Right,
and
and from what I remember about that, it happens with
COVID, influenza,
anything.
any vaccines.
If you get sick even, you can get Guillain-Barré.
Yeah.
Dr. Ravi Vimuri, who is with CIC and deals a lot with COVID infections, I asked him, is there anything that you would like me to say to the public? And he said, get your vaccinations. And I also talked to some medical residents from Mercy One, Dr. Singh, and Dr. Singh was talking about as he cares for these patients and some of them that become critically ill, they actually call family members and say, hey, go get your vaccinations before you get sick like I do. You should get that done. And I was thinking, maybe the reason you wanted a seasoned nurse, because you can read a lot of literature, you can see a lot of things, but sometimes what you're looking for is someone to give you an insight as to why to get it. So I did a little reflection and wrote about this because I was actually talking to some of my patients, and when I talk to them and we talk about vaccinations, these are some of the reasons they don't want to be vaccinated. They don't want to be vaccinated because someone told them they had to. So that's the reason they don't want to do it. Secondly, they're confused. There's a lot of plethora and so much information on the internet. They don't know what's reputable and what is not, and what is truth and what is not. The other reason they don't want to get vaccinated is because of corruption in systems and validity and problems with integrity of knowing what systems are valid. And the other thing is people feel invincible and they feel like that's not going to happen to me.
Until it does.
Yes. So, and what we know is, especially like in nursing or in medicine, is once it happens,
we can't fix it. It's done. But if we prevent it, we can prevent it from happening.
So we know COVID causes death, and we know safety comes first.
So for the sake of safety, it's better to be vaccinated and prevent death. So if you forget all those other notions, the bottom line is safety and the care of us that we live. And so if we get those vaccinations, it can help prevent death. It's no different than when polio came out and we got vaccinated because we didn't want to be paralyzed. We want to get vaccinated because we want to live. We don't want to end up on a ventilator.
All right, so thank you so much for listening to us today. I really hope we helped clear up some misconceptions. If anyone has any questions, they can feel free to reach out to us. Again, my name is Summer Bird.
Okay, and I'm Lori Kellner. You can email us, lori.kellner@indianhills.edu or
Summer.bird@indianhills.edu.
Yes, ma'am.
Thank you.